Hello everybody, this is Teresa LaFleur, your instructor, and we're going to talk about Introduction to Ethics, Chapter 8. And I really like this saying that's on here. Ethics is the difference between knowing what you have a right to do and what is right to do. And I think that plays a good part in our life in general, not just this field. So you can read through the objectives to see what we're going to cover here. Basically, we need to know the difference between laws, morals, ethics, and etiquette. Appraise the impact of economics in making ethical decisions. Analyze conflict between personal and professional ethics. Discuss the importance of studying ethics, and develop a thought process for making ethical decisions. So let's flip on over here. And what is ethics? Basically, ethics just means character or custom. And these are what we have to build within ourselves to be able to make the correct decision. Ethics is grounded in philosophy, so you see a lot of that basic view or point of view that is there. The study of bioethics is real important in our field, and this has to deal with what are the implications of biological research and the applications. So it's a lot more of yes, we have the ability to do it, but should we do it? So you see a lot of that with the bioethics. You end up coming across a lot of legal and ethical issues. Basically, there's a dilemma there. Because either law does not seem to bring about any justice for anything, or there's no obvious right or wrong behavior, or maybe the right behavior has the wrong effect. Your personal sacrifice is also included in this because there could be a consequence of following what the ideals are. And so that's going to have an issue there ethically within yourself. All right, let's talk about morals next. And morals are the principles of what is right. What is the right conduct? And it's based, a lot of the moral issues are based on religion, especially in the Judeo-Christian, Buddhist, and Islamic traditions. And religion plays a part in morals, but it doesn't play a part in ethics. When you're looking at morals, we also have to take into what is immoral and what is amoral. Immoral is just anything that goes against morals. Amoral is it doesn't even consider morals when determining what choice to make. So those are two different processes that are against morals. When dealing with morals, our society is it's a melting pot. We have all different religions, all different ethnic peoples. So our ideas of what is right morally is different for each one of us. The problem you run into, or what we run into a lot, it's a political process that occurs when one of those groups tries to enforce its concept of what is a right conduct on others. Then you get a lot of issues dealing with what are those moral differences, and is there one that's right and one that's wrong? Not really. It's just every person has their own morals. So let's talk about etiquette. And etiquette is what is socially acceptable for interacting within society. It doesn't require moral understanding. It doesn't require ethical reasoning. It's based on what our societal norms are, what our morals are, what our customs, what our beliefs. All these types of things fall into etiquette. And basically etiquette says, for this situation, there's a specific behavior that you need to follow. And it varies depending upon the groups of people you're with and what that particular situation is. Telephone etiquette is one of the biggest ones with when we're dealing with medical, because they're our frontline people. If one person has really bad telephone etiquette, it can have a big impact on the practice or the office in general, just because of the way they handle situations, and their telephone etiquette is not professional. A couple of things that are really important with medical etiquette is, there is a protocol. You're required to do certain things. You're required to be polite. You're required to dress a certain way. Use courtesy. All these things come into effect. You can't come into work in shorts and a tank top. You have to wear, most places, scrubs. But you'd have to be professionally dressed. A lot of places will only allow certain numbers of piercings to show. Or you can't have tattoos showing. It all varies, but these are different codes of etiquette within an office, especially in the medical field. And you always have to be polite. Even though that patient is angry, you have to remember they're not angry at you, they're angry at the situation. So let's talk about the ethical environment of healthcare, and the biggest thing there is you need to realize that our economic system in general, not just healthcare, is based on supply and demand. But when you hit it, our healthcare system, if that demand exceeds the supply, then costs could determine who is able to afford those services. One thing that came about with this is the President's 1983 Commission report, and two of the main items in that report were that society has a moral obligation to ensure that medical care is equitable, that everybody has a right to it, and that it is a right. That's one of the things that came up in this commission. So when they're talking about is medical insurance a right in this report, that's what they came up with. Yes, they agree with that. So a lot of times we have to look at how can we handle making sure that everybody gets medical care. I'm having a hard time with that today. And probably managed care is one of the main things that came about in dealing with this, is trying to manage those costs so that it is possible for everybody to have care. And the managed care organizations also help with making care decisions because it's all based on cost. So let's talk about healthcare versus medical care. And the WHO, I'm sure you've heard a lot about them lately with all that's going on right now, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's a pretty broad definition, and what we consider healthy for one person may not be healthy for another, so it's very subjective. This means different things. If you're ill and requiring medical care, then that is not subjective because it's pretty easy to determine. It's objectively done there. Preventive medicine kind of straddles that dividing line between healthcare and medical care. We prevent illnesses with inoculations, and that's to help prevent society as a whole. And you're seeing a lot of this happening right now where they're saying, stay home and don't interact with people, stay at least 6 feet apart and all that. These are trying to prevent or slow down an illness that's going on right now, and that could be part of that preventative side. Prevention of illness, such as controlling things with controlling your diet or smoking, exercise, how you drive, stress, all of these are very subjective preferences, but those are also things that we have to take into consideration when we're talking about healthcare. If we make sure that we control all those, then our health will be better. And if we ignore them, then it's going to cost us more in the long run, because there's not a way of treating any of those inexpensively. They can be very expensive to treat in the long run. Alright, the next thing we're going to talk about is private choice versus common good. And this talks about, as we increase the number of people that are covered under medical insurance, we have to start limiting their options for who's going to provide that medical insurance. Maybe a very short time to choose who you want, and it has to be within usually a list of providers that's been given to you. So you may not have the opportunity to check any of them out. You may have to choose very quickly. So what is the importance of studying ethics? We all have to know that patients need to know, and we need to know the risks involved in certain procedures. And it's very important for medical providers to understand their own ethics and develop those ethics. And physicians might end up having to deal with conflict that develops between what their personal ethics are and what the daily occurrences in this profession of medicine is. One of the things it talks about with the coronavirus going on now, especially in areas like New York, California, where it's tremendously covering the entire states, physicians may have to make a decision on who gets a ventilator and who doesn't. There's going to be a conflict then between their own ethics and what they're having to do within their profession. And so you're going to see some of that may happening, and I know that's already going on in Italy. I believe they were talking about they were having to make those decisions, and I hope we never get to that point, but it is entirely possible. Physicians are already having to make decisions that dealing with scarcity of resources and not wanting to infect their families. All these types of things, their values are brought into play against what is going on in this profession right now. So let's summarize the chapter. Making a decision, an ethical decision, isn't easy. It's not simple. It can be a difficult process to go through. This chapter talks about different medical ethics, could be bioethics also, and how to distinguish the difference between those clinical, legal, and ethical decisions. What is the difference between ethics, morals, and etiquette? And there's a probability that they're all going to come into play when you're trying to make that ethical decision. So I hope this helped on this chapter, and we will talk more on the next one.